In the 14th century, the Black Death swept across Europe, wiping out nearly a third of the population. The world was unprepared. There were no systems in place to track the spread of the disease or its source. Fast forward to the 19th century, cholera outbreaks sparked the revolutionary work of Dr. John Snow, who mapped cases and traced the epidemic to a contaminated water pump in London. His groundbreaking approach laid the foundation for what we now call epidemiologic surveillance, a critical tool that continues to save millions of lives. Today, in an interconnected world facing pandemics, emerging diseases, and global health crises, epidemiologic surveillance is our early warning system. But what exactly is it? How does it work? And why is it so vital? Stay tuned as we explore the fascinating world of epidemiologic surveillance, its types, key attributes, and limitations. Before we dive in, don't forget to hit that subscribe button and turn on notifications to stay updated with insightful content on public health, medicine, and more. What is epidemiologic surveillance? Epidemiologic surveillance is a systematic collection, analysis, interpretation, and dissemination of health data. This process helps identify public health threats, monitor disease trends, and evaluate the effectiveness of interventions. Definition: surveillance is the ongoing and systematic collection, analysis, and interpretation of health-related data essential to planning, implementation, and evaluation of public health practice. Purposes of epidemiologic surveillance. Why is surveillance so important? Here are the key purposes. 1. Detect outbreaks early. Timely data collection helps identify emerging health threats. 2. Monitor disease trends. Surveillance tracks the incidence and prevalence of diseases over time. 3. Evaluate interventions. It helps assess the effectiveness of public health programs. 4. Guide public health policies. Data from surveillance informs decision-making. 5. Resource allocation. Surveillance ensures the efficient use of resources by identifying high-risk populations. Types of epidemiologic surveillance. Surveillance systems come in various forms, each designed for specific purposes. 1. Passive surveillance. Relies on healthcare providers to report cases. Cost-effective but prone to underreporting. 2. Active surveillance. Public health officials actively seek out data. More accurate but resource-intensive. 3. Sentinel surveillance. Focuses on selective reporting sites. Useful for monitoring specific diseases or trends. 4. Syndromic surveillance. Monitors symptoms rather than confirm diagnoses. Useful for early detection of outbreaks. 5. Integrated disease surveillance and response. Combines data from multiple sources for a comprehensive view. Activities in surveillance. Surveillance involves a series of interconnected activities. 1. Data collection. Gathering information from healthcare providers, laboratories, and communities. 2. Data analysis. Identifying patterns, trends, and outliers. 3. Data interpretation. Understanding the implications of the analyzed data. 4. Dissemination. Sharing findings with stakeholders, including policymakers and the public. 5. Response. Implementing interventions based on surveillance data. Sources of surveillance data. Where does surveillance data come from? Key sources include 1. Healthcare facilities. Hospitals and clinics report cases. 2. Laboratories. Test results provide crucial data on pathogens. 3. Vital records. Births, deaths, and other vital statistics offer insights into population health. 4. Surveys. Health and demographic surveys capture additional information. 5. Community-based systems. Local reports from community health workers. Characteristics of surveillance systems. A good surveillance system must have the following characteristics. 1. Timeliness. Data must be collected and analyzed quickly. 2. Flexibility. The system should adapt to new health threats. 3. Simplicity. Complex systems can lead to errors and inefficiencies. 4. Sensitivity. The ability to detect even small changes in disease trends. 5. Representativeness. Data should reflect the true health status of the population. Attributes of a good surveillance system. For a surveillance system to be effective, it must have these attributes. 1. Acceptability. Stakeholders should willingly participate. 2. Reliability. The data collected must be accurate and consistent. 3. Cost effectiveness. The benefits should outweigh the costs. 4. Actionability. The system should enable prompt interventions. Common limitations of surveillance systems. While surveillance is critical, it's not without challenges. 1. Underreporting. Many cases go unreported, especially in passive systems. 2. Resource constraints. Limited funding and staffing can hinder effectiveness. 3. Data quality issues. Inaccurate or incomplete data can lead to misinterpretation. 4. Delayed responses. Timeliness is often compromised in underfunded systems. Despite these limitations, improving surveillance systems can mitigate their impact and enhance public health outcomes. If you found this video insightful, remember that epidemiologic surveillance is just one of many fascinating topics in public health. To stay updated on critical health issues, hit that subscribe button and join our growing community of health enthusiasts. Share this video with friends and colleagues to spread awareness about the importance of surveillance in protecting public health. From the devastating plagues of the past to the modern battle against pandemics, epidemiologic surveillance has been a cornerstone of public health. As technology advances, so does our ability to track and respond to health threats. Together, we can build a healthier, safer world, one data point at a time. Thank you for watching, and until next time, stay informed and stay healthy.